Diversity, equity, and belonging. As many recognize and celebrate Asian Americans, Native Hawaiians, and Pacific Islanders, this month, inclusion is top of mind. And our Isabel Lawrence sat down with one local woman who is living those ideals every day through her work, which impacts patients at university hospitals, but also the community at large.
If these halls could talk.
And then we have our 2 postpartum floors, like I said, on 3 and 5.
Celina Cunanan would be the keeper of their stories.
So this was the room that my son Mason was born in.
Not to mention the countless other babies she's brought into the world.
I think it was just always just this love of being fascinated by birth and fascinated with that joy and that miracle that happens.
Celina started as a midwife at university hospitals in 2001. Becoming division director for nurse midwifery in 2007, then system chief for nurse midwifery in 2017.
Yay!
Former patient Stephanie Purdom met Celina first as neighbors, trusting her to deliver her daughter.
Celina is someone who really authentically cares for people. I felt that day, and I feel it every time I see her in the neighborhood and she wants to hold Iris and is asking about how we are.
Iris, now 2, is the last baby Celina delivered before transitioning into her current role as Chief Diversity, Equity, and Belonging Officer in 2022, overseeing the hospital system's strategies to promote a culture of equity within the organization and the communities it serves. A path you could say she was born into.
I always kind of joke around that it's my family business. I went into the family business.
Her dad, an obstetrician, her mother, an OB nurse. Filipino immigrants who moved to New York in 1969.
They instilled in me this incredible work ethic of really trying my best at everything I did, really not setting any limitations on what you could do. I think that they set me on a path to really believe.
Influencing both her past and present work with a distinct focus on the inequalities impacting maternity care for Black women and babies.
For me, as a woman of color, right, as a daughter of immigrants, my husband is Black, I'm raising biracial boys. What is the impact that I can have on this organization and then on the communities that we service?
According to 2021 data from the Cleveland Department of Public Health, Cleveland's infant mortality rate surpassed both national and state averages, with babies with Black mothers more than twice as likely to die in their first year than babies with white mothers.
She's a clinician, so she's been on the front line of this mother-baby disparity for a long time, and she has one of the largest midwife programs, in the country.
Celina's care and impact seen by colleague Dr. Daniel Simon.
And I think she brings a cultural sensitivity of the importance of supporting individuals and going to them in their own neighborhood and reaching them at their own cultural needs.
In her current role, she also oversees the Food for Life markets, which help address food insecurity and healthy food access, as well as the Health Scholars Program, exposing students to careers in healthcare. The impact of access and outreach, something she understands firsthand.
We know what a huge influence that can have on kids, on just thinking oh, I can do that. I see somebody that looks like me, and I want to do that, what they do. It's the same opportunity I got so many years ago as working at 15 in my dad's office. And I just want everyone else to have those opportunities to access that as well.
Isabel Lawrence, 3 News.